On what one source described as a sardonic and cruel April Fool's Day, the Trump administration hit HHS with massive layoffs.
The full extent of the layoffs still isn't clear. HHS never released any information beyond its first press release on March 27th about how it intended to make the cuts. That basically said that HHS would cull 3,500 people from FDA, 2,400 from CDC, and 1,200 from NIH. What we do know that Elon Musk and the Department of Government Efficiency have had a very heavy hand in the RIF notices, that's the reduction in force, and in the reorganization. And that's based on interviews that were given by both HHS Secretary Robert F. Kennedy Jr. and Musk and his Doge team. Kennedy told News Nation that Doge created the new org chart for HHS.
So, what has happened at CDC?
We're seeing entire divisions and offices just eliminated. Last week, I reported that the Office on Smoking and Health was completely eliminated. That means that state programs funded by CDC that help smokers quit are in limbo, and we don't know what's going to happen to them. It was a similar situation for the Division of Population Health. Almost all of their employees were cut, with the exception of those working on the behavioral risk factor surveillance system. But the Alzheimer's work that's being done, which is authorized by Congress to the tune of $33 million per year, and which was just reauthorized for another 5 years, that work is just going to be gone. Both of these entities fall under the National Center for Chronic Disease Prevention and Health Promotion, which had a lot of other programs targeted, including the Division of Reproductive Health. That's the pregnancy risk monitoring team, and that has been axed in its entirety. I'm now working on a story about an STD database that's been tracking antibiotic resistance among syphilis and gonorrhea since 1988. It looks like that program is just over. People are really just kind of stunned by these developments.
What do we know about firings at FDA and NIH?
Well, we know from other reporting that at least 5 directors from the NIH's clinical centers have been reassigned. Science magazine reported that 10 principal investigators from the National Institute of Neurological Disorders and Stroke were accidentally fired, and it appears they're going to be able to keep their jobs. We also saw that some FDA leaders were reassigned, including the directors of the agency's Tobacco Center and the office that reviews new drugs. The New York Times reported the FDA also lost lab scientists who test food and drugs for contaminants and bacteria, as well as veterinary specialists who are investigating bird flu transmission. So experts say we'll be feeling the effects of all of these changes for a very long time to come.